Hello everyone, welcome back to my YouTube channel nursing.com. Today we are going to learn about asthma in pediatrics. तो चलिए शुरू करते हैं इंट्रोडक्शन से. Asthma is a chronic disease in which the bronchial airways in the lungs become narrowed and swollen, making it difficult to breathe. It is chronic inflammatory disease of lower respiratory tract. Temporary narrowing of bronchi by bronchospasm. Symptoms including dyspnea means shortness of breath, wheezing and excessive cough. Boys are more affected than girls. Causes include allergy, infection, psychological factors. Etiological factors include genetic factors, in that family history, genetic predisposition, lifestyle factors, in that diet, obesity, physical activity, exercise and stress. Environmental factors, in that allergens, air pollution, respiratory infection. Other factors include premature birth, low birth weight, maternal stress, change in climate, emotional disturbance, exhaustion and exercise. These are the etiological factors of asthma. Classification divided into allergic and non-allergic asthma. First we will see allergic or extrinsic asthma. In that hyperimmune IgE responds to inhalation to specific allergen. A children with extrinsic asthma usually have a positive skin test to the offending allergen and a positive family history of allergy. Then non-allergic or extrinsic asthma. In that unidentified factors of environment, irritable and hyperactive airway, no hyperimmune response, may be positive family history, inhalation of irritants, exercise, drugs, change in temperature, atmospheric pressure, viral respiratory infection, emotional stress. This is the classification of asthma. Pathophysiology. In that allergen or irritant exposure, immunological response, then inflammation and airway edema, then airway smooth muscle contraction, mucus production and airway obstruction, then respiratory symptoms, chronic inflammation and airway remodeling. Clinical manifestation, in that nasal congestion, rhinitis, sneezing, coughing, upper respiratory infection, tightness of chest, itching, polyuria, mental excitement, dyspnea, expiratory wheezing, nasal flaring, restlessness, sweating, exhaustion, tachycardia, cyanosis, pallor, anxious and pale, abdominal pain and vomiting in intense cough. Attack may be subside after 1 or 2 hours. Suffer with attack for a period of 2 to 7 days. Then there may be symptom-free interval for several months. In chronic cases, chest become barrel-shaped with increased anterior-posterior diameter. Diagnostic evaluation by physical examination, chest X-ray, peak expiratory flow rate, spirometry, pulmonary function test, allergy test, in that skin test and radioallergosorbent test. Management of asthma by educate parents, avoid allergen and irritants, prevent infection, monitor daily symptoms, bronchodilator like salbutamol, theophylline, oral steroid, preventing medication, in that montelukast, inhaled steroid, long-acting beta agonist. Asthma in non-severe cases, treatment, in that assess severity of problem, nebulized by salbutamol, oral doxycycline, montelukast, oral prednisolone. Asthma in severe cases treatment, in that monitor severity of illness, oxygen administer, frequent salbutamol nebulization, intramuscular hydrocortisone, oral prednisolone, montelukast and antibiotics. Asthma life-threatening or status asthmaticus treatment, in that admit in PICU, oxygen administration, IV fluid, frequent salbutamol nebulization, nebulize ipratropium bromide, IV hydrocortisone, IV methylprednisolone, IV aminophylline, IV magnesium sulfate, antibiotic. Prevention of asthma by breastfeeding up to 6 months, control air pollution, avoid allergen, avoid exposure to cold air, no pets, birds in house. Nursing management of asthma by evaluating respiratory status and general condition, positioning, administering oxygen therapy, administering medication, administering fluid therapy, maintaining adequate dietary intake, maintenance of hygiene measure, supporting parents and family members. Thanks for watching.